Type 2 diabetes has a cruel talent. It can quietly damage your body for years before it ever feels like a disease. And here's the number that should stop you. In India, more than half of all people with diabetes don't know they have it. More than 50% living with it unaware while it quietly does its damage. The reason isn't that the symptoms don't show up, it's that they're so easy to miss, blamed on age, on the heat, on stress, on a busy life. So today, let me walk you through the signs people overlook. And one honest thing up front, none of these on its own proves you have diabetes. Many have perfectly innocent causes. But if a few of them show up together, that's your cue to get a simple blood test, not to panic. Let's start with the classic three, the ones everyone can name and still miss in themselves. One, frequent urination, especially at night. When your blood sugar is high, your kidneys work overtime to flush the excess out, pulling water with it. Getting up 2 or 3 times a night to pee is easy to blame on age or on what you drank. But a new ongoing pattern of it is one of the most common early signs. Two, constant thirst. All that flushing leaves you dehydrated, so you drink more, which makes you pee more, a loop that keeps feeding itself. Being thirsty, no matter how much water you drink, is your body trying to keep up. Three, constant hunger and fatigue. Here's the cruel part. Your blood is full of glucose, but your cells can't get it inside to use as fuel. So you feel hungry even after eating and tired no matter how much you rest. This isn't normal end of day tiredness. It's a deep, unexplained exhaustion. And almost everyone blames it on stress. Now, the signs almost nobody connects to diabetes. These are the ones that matter because these are the ones that get missed completely. First, and this one's important, a dark, velvety patch of skin on the back of your neck. It's called acanthosis nigricans. Darkened, thickened skin, most often on the back of the neck, but also the armpits or groin. People scrub at it thinking it's dirt. It isn't. It's a visible sign of insulin resistance, and it's strongly linked to diabetes. If you or someone in your family has a dark ring around the neck that won't wash off, get a blood test. Next, a sudden crop of skin tags. Those small, soft skin growths, often on the eyelids, neck, or armpits, cluster more in people with insulin resistance. Then, cuts and wounds that heal slowly. High blood sugar hurts your circulation and your immune response, so a small cut that should heal in days drags on for weeks. Recurrent infections. Excess sugar feeds yeast and bacteria, so repeated urine infections, frequent gum or skin infections, or thrush that keeps coming back can all point to high blood sugar. Tingling or numbness in your hands and feet, a pins and needles feeling, that can be early nerve damage from high sugar. Easy to dismiss as your foot falling asleep, but a persistent version deserves attention. Blurred vision that comes and goes. High blood sugar can make the lens of your eye swell, changing your focus. Vision that blurs and clears isn't always tired eyes. An unexplained weight loss, losing weight without trying, even while eating normally. It feels like good news. It can be a warning because your body, unable to use glucose, has started burning fat and muscle instead. Now, why does this matter so much more in India? Two reasons. First, that 50% undiagnosed figure. India has over 100 million people with diabetes and even more with prediabetes. Second, South Asians tend to develop diabetes at lower body weights and younger ages than many other populations. So, I'm not overweight, it can't be diabetes, is far less protective here than people think. You can look slim and still be at real risk. So, what do you actually do? If you recognize a few of these in yourself, don't panic and don't ignore it. Get tested because the only way to know is a blood test, and it's a simple one, a fasting blood sugar or an HbA1c, which shows your average over about 3 months. In India, screening is recommended from around age 30, earlier if you have a family history, extra weight around the middle, or several of these signs. And the reason to act isn't fear. It's that diabetes caught early or pre-diabetes caught before it becomes diabetes is far more manageable and often reversible. The silent years are exactly when acting makes the biggest difference. The test just moves you from not knowing to knowing. If this was useful, subscribe. One honest diabetes explainer every week. No fear mongering. And share it with someone who's been shrugging off a symptom they shouldn't. See you in the next one.